Hello, everybody. Welcome to Chat with the Editor. My name is Maxwell, Assistant Editor of Social Media, AJNR. And I'm excited here to be joined by Dr. Caroline Robson from Boston Children's Hospital. I'm excited to have you here, Dr. Caroline. Welcome to Chat with the Editor.
Thanks so much, Maxwell.
So can you tell us about yourself and your educational background?
Absolutely. So I was trained as a radiologist in South Africa at the University of Cape Town and Groote Hospital. And then I became a pediatric radiologist. We moved to the US in 1993. And at the time of the move, I didn't actually have a job. And I got a fellowship position at Boston Medical Center, and that was followed by the offer of a pediatric neuroradiology fellowship at Boston Children's Hospital, which fell into my lap by accident, and I was the first PD neuro fellow at Boston Children's. So I didn't really pick neuroradiology. It happened by chance, but it's the very, very best chance that I've ever experienced in my career. So if I could have handpicked a specialty, this would have been it.
Okay, so why radiology in general?
So I came from a non-medical family, and initially I really loved the surgical disciplines as a medical student. And then one day during my internship, I happened to go down to the radiology department and see the radiologist scrolling through CT images of an abdomen. And I felt absolutely mesmerized and thought, well, actually, this is what I love doing. I've always loved, as a kid growing up, I was the chief game spotter when we go into the game reserves. I've loved trying to see things, and pattern recognition was always something I loved, as well as photography. So it just blended everything, as well as a fascination for disease processes and being able to visually observe them.
Wow, amazing story. All right, so let's talk about AJNR. So what's your role as an editor in AJNR, and tell us what you do?
So I am a pediatric neuroradiology editor, and I work with a wonderful team of associate as editors. So Anna Baer and Matthew Whitehead, and then also Adam Goldman Yassar, and previously Matt Soldatelli was our junior editor. And so we rotate our jobs 1 week on and then 2 weeks off between the three editors. And we review journals trying to be fair-minded. We have a WhatsApp chat group. And so decisions that we're planning to make, we discuss and reach consensus amongst the four of us. So yeah, that's my role. It's a time of constant self-education.
That's great. So, as the senior editor, how many papers do you get to review in a year?
So I'm working approximately 1/3 of the year, and on every given week, I get between 1 and 3 papers to review per week. So it's variable. Rarely there have been weeks when I don't get any papers, but then my colleagues are certainly getting them. But that's about an average 1 to 3 per week.
Okay, so how long does it take for you to review an article? You know, the duration of reviewing to publishing, how long does these processes take?
It's very variable. So the first step is for us to look at the article, to read the article critically, and determine whether it should be sent for review. If there are major methodological concerns, or if it seems that the article is very similar to what is already in, available as published manuscripts, we may decide not to send the article for review, and generally we'll send a quick WhatsApp message and get consensus about that. So that is a fairly rapid decision that can be made within days of receiving the article. Beyond that, if we decide the article needs to go for review, we go through the period of selecting reviewers, and that can be quite time consuming because, you'll invite a dozen people and maybe one or two will agree to review, and then you have to send a request for more reviewers. So that can take anything between a week or two to multiple weeks. Then the reviewers get asked to provide their feedback within a certain time period. Some are great at responding in a timely fashion, others take longer and need to be coaxed. So that is another step of potential delay. And then, of course, revisions have to be requested and submitted. And so there are some people who are very efficient at submitting their revisions, whereas others take weeks or months. And so it's actually at that point very variable as to how long it's going to take. And then the final step is to go through the revisions. And at this point, this is on the editor or senior editor to go through the manuscript very, very carefully. And that can take, yet another couple of days to do to respond and to offer a final acceptance or further reviews, sorry, or further revisions. So it really takes weeks to get an initial decision, but it takes months for the article to actually come out into press, usually a couple of months.
So we're asking this question because people, so it takes a lot to write a paper. And we usually realize that it takes a very long time to get a paper published. And sometimes, writers would like to know why it's like that.
Selecting an appropriate number of qualified reviewers is going to be number one. Waiting for them to submit their reviews, and some people ask for extensions. And then balancing up all that information, making a final decision, that's usually fairly straightforward. So the next big delay is it's almost unheard of to accept a manuscript without requesting revisions. And so it's going to depend on how long it takes people to submit those, how complicated the revisions are. And let's say somebody's super efficient and gets their revisions in with a matter of weeks. The editor who is in charge of that paper, who is the handling editor, has to carve out time to be able to now really focus on doing a thorough final review. And I think that can be a little bit delayed as well. Personally, it might take a week or two because if you happen to get the manuscript back when you're on call or really super busy, you've got to carve out time to really give it your undivided attention.
Yeah.
So that's, I think, why. And then, of course, the manuscript goes into queue. So now you have a final decision, and let's say it's occurred within a couple of months. The manuscript's going to go into a queue, and sometimes there's a little bit of a backlog. It's going to be going into a future edition, so it'll take a couple of months again.
Okay, that's clear. Thank you so much for that. As a senior editor, sometimes what problems do you find when you're reading scientific articles?
Yeah, all sorts of problems. So the people conducting the research may think it's really fascinating, but in knowing the type of readership the AJNR has, there may be a bit of a difference of opinion between the editors and the authors as to whether the manuscript is a good fit for our journal. Next up is people may think they're providing original report, but perhaps the material has been previously published and what they're doing is better for a review article, so that distinction has to be made. And then probably the most important concern is methodological concerns, where people feel that there are problems with how the study population was selected or how the research was conducted. And I would say if I had to pick the single most important and most common cause for rejection, it is usually methodological concerns.
So usually, what do you encourage writers, to do?
Yeah, you have to. So there are all different types of papers. So, for example, for people writing clinical descriptive original reports, there has to be something more than just, I'm going to describe 10 cases of condition X. You have to sell it to your readership as to, and this is why it's important. So it's very, very important to give them a compelling reason for why they need to read the manuscript, what it is that is a compelling story beyond just a description of findings. So there's that. Then we have a large number of papers which are, you know, sort of more hardcore research, so no longer really descriptive, but providing various measurements or various assessments of, normative values or, role of AI in making a diagnosis. There, the methods really have to be very carefully crafted, very objective, very well supported. So I would say that would be my advice.
Okay. Okay. Thank you very much for that. So let's talk about your career as a radiologist or neuroradiologist. So you've been in practice for over 30 years now. That's amazing. What would you say is the best thing about your career as a radiologist?
Um, it's a very humbling career. Um, I'd say the best thing is learning new things every day, every week, every year. So there's never a dull moment. It's a very humbling experience because your mistakes are always there in perpetuity and everyone makes mistakes. And so even the most experienced person is apt to make mistakes. And I think it's a tough part of the job, but it's also a job that I think keeps everybody on their toes in a fashion that's good for patient care. I love teaching. I love working with trainees. We've got the most wonderful trainees. Residents and fellows are just phenomenal. We learn so much from them.
Okay. Thank you very much. So if you haven't said all these, if you hadn't gone into medicine, what would you do rather?
I can't think of anything else I would have done.
Really?
Yeah, it's just a good fit.
Wow, that's interesting. Some people talk about they'll do politics, they'll do that, but
No, never, never, never.
okay, that's great. That's great. So yeah, so you spoke about how many hours you work for the AJNR as well as your practice as a neuroradiologist. It can be very stressful. I think one of the things that bothers a lot of doctors right now is mental health problems. How do you get your mental health strong? How do you cope with mental health awareness?
Yes, very important. I exercise every day whenever humanly possible, and that exercise has to be outside, even if it's in the dark and even if it's in the middle of winter in bitterly cold temperatures. So it's very, very important to stay fit, stay that 45 minutes just clears your mind and just makes you feel much healthier. My husband and I both love, and in fact, all our family, we've got three kids, three adults. Everybody loves cooking. So to me, it's very important to eat good food, to spend time cooking, to spend time as a family, and to cook with friends and host friends. And I think all my friends, we all love eating. Read a good book for 5 minutes at bedtime. You just have to have the balance. And then the other really important thing to me is family. So I make sure that I'm there for all the major events for each and every member of the family. So somehow balancing work and balancing family commitments is key because you don't get a second chance to be, in my case, a mother. Um, and that is really important to staying healthy and happy in work is to have all those components balanced.
Okay, that's amazing. Do you have any advice for residents and prospective medical students who would like to go into radiology?
Yeah, your time is much about figuring out what you don't want to do as what you do want to do. And in the end of the day, you really want to feel that you've found your calling. You want to feel that you're making a difference. So there's something very gratifying about being in a specialty or being in a job where you feel you're able to make a difference. You're able to improve the lives of your patients, help your referring clinicians as a radiologist, have meaningful relationships with your referring clinicians. To me, that is really important. So whether the radiologist figures they want to go into private practice or whether they figure they're going to do an academic career, you just want to feel that it's really meaningful in some way. It's more than about just earning a salary.
Thank you. This is a very important question. The rise of AI in the medical health or the medical sector. Do you think radiology should really um, be scared as AI rises so high? What's your take on that?
No, I think radiologists should be working feverishly to leverage AI. And there's concern as a pediatric neuroradiologist that we're a little bit behind when it comes to pediatrics. But I think there are so many incredibly helpful potential applications, whether it's going to be lesion detection in epilepsy imaging, comparing size and morphology of brain tumors over time, comparing size and morphology of demyelinating lesions in kids with, autoimmune diseases, multiple sclerosis, what have you. We're using AI in terms of spine imaging, so synthetic CT with regard to spine MRs. I'm so excited about AI and feel that AI should serve as a partner to human beings, and there's huge scope for it.
All right, thank you. Thank you so much for your time. Do you have any favorite radiology sign?
I do. So my favorite area is pediatric temporal bone imaging. And so I use little signs to help people remember syndromes. And so the baseball cap sign is the cochlear in incomplete partition type 2. The unwound sign is the cochlear in branchiotorenal syndrome. The corkscrew sign is the cochlear in IP3 and X-linked mixed hearing loss. So those are my pet signs.
Amazing. Thank you so much for joining us, Dr. Robson. It was an honor having you.
Thank you so much. It was an honor to talk with you, Maxwell. It's wonderful to chat with you.